Thank you very much. It's really been a pleasure to be here all day. Frank, I have learned so much listening, and each of the presentations has really been provocative in its own way and caused me to shift my thinking from one thing to another in a way that has definitely been grounding regarding the things that we think about every day at PolicyLink. Haven't felt that we've talked quite enough about context, though. And I think context is everything when you're talking about evidence. There's been a lot of acknowledgement here of something that in my years in the field, I often am frustrated that it's not acknowledged enough, and that is that no one cares more about outcomes for which we need evidence than parents and service providers and community members. I used to be downright insulted when I worked in a local community, and the evaluators would come in as if the parents we worked with every day and all of those who were working directly with community members didn't care about outcomes. That's why they do the work, and parents just want the best for their children, and they hope that all of these people who are surrounding their children are there to do that, to produce the best. So I've loved the acknowledgement of that. But we haven't talked enough about the context in which there are people, sadly, who are working in government and sometimes in organizations who really don't want the best. Not that they want to work for something bad, but they really don't care about the outcomes. Too often they don't believe that the children can succeed or that the families can do better. And they're quite willing to take the money, whether it's taking a grant or whether it's coming to work every day and taking a paycheck or coming to work and being in charge of something quite grand and not really caring about what happens. And evidence and a focus on outcomes is very important in that context. We haven't talked enough about that context and how important it is to have accountability in the systems and accountability that goes beyond the people who are dedicated to doing the very best. We have them all in the mix, and it's important to think about in a mix where you have both people who are very dedicated and people who are not so dedicated, who ought to be accountable for the resources that they're receiving to produce some outcomes. We haven't talked enough about race and the shifting demographics in the nation and the heightened emphasis that we now have to have on getting outcomes for all, that I love the way Tony drew our attention to the fact that just because something passes the litmus test of being effective, because maybe 60 or 70% of those who are getting whatever it is that's being given are doing well, if you have 10, 20, 30, 40% who are not doing well, that's where we need to focus. And too often, it's our children who are Latino and African American who are disproportionately concentrated in that 20, 30, 40% who are not doing well. And I love the way he focused the attention on that and suggested that we need to constantly use data for continuous improvement, that we need to get better at getting better. And the way to be better at getting better is to make sure we're not systematically leaving the same people behind all the time. So I thought that was useful, but we need to talk more about that. I thought in general that this is a very friendly group, more friendly to evidence than I was expecting when I came in. I think that in this conversation, I'm hoping that we can tease out some of the places where we don't agree, because I heard so much consensus around the notion that, yes, we need evidence, and evidence comes in different forms, and different people have to use it in different ways, and it just seemed to be just total agreement about that. I suspect that we're not solidly behind that the way that the conversation seemed. But let's not just spend all your time hearing what I thought. We have a panel here, and we all had thoughts and reactions, and we want to quickly get through our panel and hear from you, because I think that's where we're really going to be able to figure out what's the next step. What is it that we stand on, and how do we go forward? We have with us Lawrence Green, professor in the Department of Epidemiology and Biostatistics at the University of California at San Francisco Medical School. Michael McAfee, who is my colleague, director of the Promise Neighborhoods Institute at PolicyLink and a senior director at PolicyLink. And Shivam Malik Shah, who is the Senior Advisor, Results for America, America Achieves. I asked them each to offer some reflections. I'll ask them some follow-up questions. And if there's anything else about them that they would like for you to know, to use that as part of their beginning. And so I think we'll just go down the line, Michael. What are your reflections? I saw you were here all day, too.
Sure. I think one of my initial reflections is that we use this notion of results at scale, and people nodded their heads. But I don't know if we've bought into that as a nation. Results at scale is our work. I do believe that it is our work. When we talk about systems and achieving results, I think that we know how to do things at a small scale. But this notion of us being disruptive to the very systems that we say need to be changed, I don't know if all of us are ready to put the skin in the game. When I listen to the conversations around evidence, sometimes it quickly falls back to the folks on the ground. But when I connect that up with the literature of collective impact, what I get excited about evidence, what I get more excited about when I think about bringing discipline execution like results-based accountability to the work, is that it gives us a context for aligning all of our contributions around a result and measures of progress. And I think that close coupling of our contributions is often missed when we talk about evidence. So I'm concerned because I think that our field is using language, parroting language that we actually haven't committed to. And it hurts us in Congress, and it hurts us in other places. And so I get concerned, I get excited when I hear us talk about results at scale. And then I get frustrated when I know people like Sandra Samuels, who's actually creating a market for results, when her work isn't actually the thing that folks want to fund. When I know for a fact that when you start talking about systems changes in communities, working with school districts, the very folks with the political capital who could remove barriers actually don't own a contribution to the 10 results and 15 indicators in promised neighborhoods. So when I think about this work of results at scale, I'm excited about this conversation because it gives us another opportunity to really think about what it takes. When I think about it being married with collective impact, I even get more excited because there's a window there for us to begin to align all of our beautiful contributions behind a specific result and a specific measure of progress. And then lastly, I get excited about evidence because this new evidence is something that I think we have to wade into very carefully when we think about adaptive work. We keep saying to folks that we want them to do the adaptive work, but by this very nature, that is work for which there is no answer. And so I'm concerned when we think about evidence and we don't also think about what we're calling people to lead on, adaptive work in an area where we don't know how to do it.
Say just a little more about adaptive work. What do you mean and why you say there's no answer?
Well, when I think about the Promised Neighborhood sites, what's been exciting is that in some cases they wrote a grant for a program. And they've learned now that in order to achieve collective impact, it actually is, they've got to do a lot more than manage a program for 5 years. But that to build a cradle-to-career continuum of solutions in a community where no one knows how to do that, where there is no blueprint, is really hard. Mm-hmm. To exercise leadership in an environment where early learning providers do not have to listen to you. And you have to figure out that notion of being in relationship with people is your currency. Mm-hmm. To figure that out. That is the work. That is the challenge. And that's the thing that we're not paying attention to. Think about NASA's work, for example. They went from about $1 million organization to a $30 million organization overnight. We're asked to staff up from about 15 people to 70 people in a year and get results. Now, most of us who have run organizations know that we're not even ready to start talking about getting results. It would be one thing if you were just asking the lead agency or the backbone organization to do that, but now put that into a community context, where even the mere fact that you got the grant in some communities has your blackness being questioned, on top of other political issues, on top of the fact that then the community hasn't even owned the 10 results and 15 indicators yet. That's the opportunity, that's the journey towards results over a 20-year life cycle. That's our work. And when we call for evidence and don't take in the operational aspects, don't situate it into the politics of that community, and also don't have any of our own skin in the game, that hurts the field. As an institute, this is the last thing I'll say, is one of the things that we learned very early on is that if we were truly going to be true to collective impact, we had to own the same 10 results and 15 indicators as our colleagues on the ground. It would be so easy to fly in and out all across the country and do PowerPoints and give units of coaching and then leave. That is not our work. Our work is to find out our contribution from where we sit at a national level to advance the same measures on the ground and help to remove those barriers. And so that's what I mean when I talk about this work, the adaptive work of it and the opportunity of results at scale and the perils of it.
Mm-hmm. Thank you very much. Shivlin, what do you think? What have you heard?
Yeah. Well, I'm excited for 3 reasons. One is that I think some of the early investments in evidence, data, and evaluation are starting to show us some results. And I think as a community, we can learn from those results and course correct, and that's an opportunity. And Angela mentioned that I now am an advisor to Results for America. Previously, I was at the Department of Education where I had the chance to work closely with Jim Shelton to run the first year of the I3 program and the first year of the Promised Neighborhoods program. Both of those programs at the time were quite different than their predecessors, and over the past 5 years have evolved tremendously. And I think all of us who've been connected to those programs would say for the better. Clearly, we were learning as we were going along, and I think it's important that even in those instances, we were willing, or able, I should say, to take the chance to put those programs in place. But again, over the past few years, some of the results are coming forward, and we're learning from that, and we're doing better. Before that, I had a chance to work at the Gates Foundation in the early days and was very closely involved with the work in New York City with the transforming low-performing high schools and turning them into new small high schools. Again, very controversial for lots of reasons. But now there are multiple rounds of evidence that MDRC and others have put forward that can help us quantify the impact of those solutions. And we can see that no matter how you cut the data, students are doing better. And they're doing better, dramatically better. And there are debates about whether it's scalable, whether it's the right policy, but there isn't a debate any longer about whether it actually improved graduation rates. And so again, we have more instances of where we can actually point to evidence that can help guide policymakers if they choose to let it. So I'm excited that that's starting to happen. I'm also excited because I think this is an area where you can actually get something done here in Washington. There are so few things where there's bipartisan support. And at Results for America, we've been working very hard to continue to cultivate support from both the left and the right. We've done that in a bunch of ways. I'm happy to talk about that in more detail if that's of interest. But at a time when it seems very difficult to move the ball forward on certain issues, this notion of using data, evidence, and evaluation to guide decisions is one that has good traction on both sides of the aisle. And the last reason I'm excited is because I feel like part of what we've been trying to do at RFA and what I've seen many people in this room try to do is to connect the dots across sectors. And I think there's starting to be some emerging roadmap of how the government, the funding community, nonprofits, and evaluators can start to work together to make some of the changes happen that we think are necessary. And I think in general, there's an understanding that it's a little bit of everybody's responsibility and not just the nonprofits that need to do better or the funders that need to pay for more evaluations.
Thank you. Larry?
Well, I'm excited too. I'm excited to see if I can figure out these 6 pages of chicken scratch. As my assignment was to, on behalf of the Friends of Evidence Group, to reflect on what has been said in relation to the elements of a powerful approach to evidence, which is figure 3 in the booklet in your folder. So I refer you to those pages surrounding figure 3 for the context in which we have put those elements forward. Number 1 is many sources of evidence inform intervention design. Dr. Rivlin led us off this morning with the notion that evaluation was a radical idea at HEW when introduced in the Johnson administration. She was then she was the Assistant Secretary for Planning and Evaluation at that time, and she was pursuing the idea of planned assessment of social experiments. So I think that helps to anchor the historical context for our enterprise here at a point in time and a set of legislative initiatives as well as administrative initiatives around evidence-minded progressives and their interests in evaluation. She made the statement that I think really stuck with me: we might win the battle for evidence and lose the battle for social policy if we don't wake up. And she was referring specifically to us waking up to the implications of the last midterm election. the implications with respect to attitudes of the public and attitudes of Congress toward some of the things that we're discussing here. Tony Bright outlined the steps in generating evidence-based practice under the RCT paradigm of evidence, from the academic-based idea of the randomized controlled trial through the phases to implementation with fidelity and all of its moral overtones, which in effect blames the practitioners if it doesn't work, when in fact it probably doesn't work in many places because it wasn't adequately contextualized by the evidence in the first place. So we need to get a hold of this pipeline, and it is for me, I've tried to trace what happens in the pipeline, and it turns out to be more of a funnel because it gets squeezed at every point. And a lot of the best evidence, the most useful evidence, gets squeezed right out of that pipeline by the time it reaches the potential users. The critical question, Tony said, is not what works, rather how do we advance effectiveness across the different settings, populations, contexts in which it would like to work. What will it take to achieve quality, reliability at scale, and I would add across the varied settings, the multiplicity of settings and contexts in which it would be applied. He left us with the bumper sticker poetry, learning fast to implement well to advance quality, reliability at scale. I want to set that to music because I think we can use that down the line. Sandra Samuels reminded us how little use we make in the social service fields of customer wants. The data that on customers is so thoroughly used, she pointed out, by industry, and we're making very little use of it. And she wondered why, and made me wonder why as well. Element 2 among the elements of a powerful approach to evidence is that results shape implementation. Dr. Rivlin said that we have to keep trying variations and evaluating results. And she talked a lot about the Head Start example, and it was such a rich example of government-driven evaluation with all of the impetus that it brought to evaluation, at the same time the resistance that built up around it, in part because it was perceived by those who implement programs that we want to study it, they want to do it. And that was, I think, a very pithy encapsulation of the dialectic that occurs between us and the application community. We aren't going to discover some magic formula, she said, so we need varied methods and study designs. Tony Bright showed us the example of reading improvement, where the spectacular average effect size obscured the neglected variations across schools, and the proverbial black box of all the things that must be brought into play in the implementation process. So implementation has become increasingly the anchor that NIH has grasped in the health field to make sense of why so much that has been invested in the basic research that they sponsor, why so little of it is being implemented. So they've undertaken a pretty substantial initiative in dissemination and implementation research. Tony recommended we get under the hood of root causes, and he said we need to start strong, and we need data to tell us how strong we started. Examples of data on changes in student mindsets, beliefs, math learning. I thought those were all very rich ways to think about what's under the hood. He talked about the plan, do, study, act cycle, the need to learn from failures as well as from the successes. Element number 3 is the goal-oriented networks accelerate knowledge development and dissemination. Alice Rivlin talked about the confluence of the civil rights movement with the Head Start and other war on poverty programs. And it was a fortuitous but very valuable confluence, but it also created some tensions. One that she particularly pointed to that was poignant for me was the way in which it pit the federal government, particularly the Civil Rights Initiative, necessarily pit the federal government against the states. And this was an unfortunate undercutting of the essential role that states could and must play in the long run in channeling capacity development to localities, from federal to local. But it certainly worked usefully in overcoming the state resistance to civil rights reforms. But I think my model for federal to state to local relationships is CDCs, where they do most of their funding through the states to the localities, with a lot of monitoring and surveillance to be sure that it gets there. Tony Bright talked about networks. People involved in doing the work are the ones developing, applying, and sharing the knowledge. Robert Kahn referred to, as a pediatrician working in a hospital and heading a unit called Population Health, represented in a way what's happening with hospitals and their relationship to community data and the need for outreach and an upstream perspective on what's behind the flow of patients, the revolving door of patients when they come for medical care, are fixed up, patched up, and sent back out only to return with the same problems at later points in time. And the need in all of that for linking institutional relationships at the community level to assure that we are looking at the whole patient, the upstream determinants of the patient's relationship in the community to the medical care system. Element number 4, next to last, the multiple evaluation methods fit diverse purposes. There are multiple stakeholders, multiple disciplines, and Alice Rivlin talked about how most people who use the term silos and stovepipes, you'll recall, are people who have never seen one. And she reminds us that we need to be cautious about some of those kinds of metaphors. Anne Williams-Eisen alluded to every one of the children in her program represents a project. And thinking about data points in that way I thought was refreshing. John Cania, in heading the next panel, talked about relationships between systems and individuals as the unit of analysis. Collective learning across organizations and systems requires some reconciliation of the differences in methodologies, data sources, and treatment of evidence. And the last principle or element is a strong infrastructure supports continuous learning for improvement over time. Alice Rivlin said that we can't do the necessary evidence production at the federal level for all of the variations in local needs and programs and policies. We must strengthen infrastructure for data and learning at the local level, and can't do that with national surveys. We've got to build the capacity, she argued, and others have argued, build the capacity for localities to generate their evidence that are specific to their settings and institutions. Evidence and continuous learning, she said, should not be a hard sell with industry or with anyone else for that matter. We really have an important message with respect to evidence and continuing learning that shouldn't be difficult for us to promote. Hillary Gates and her foundation, the Ford Foundation, offered us some examples there. Tony Bright said, structured networks can accelerate learning to improve, a learning exchange and source of comparison and inspiration, and a moral imperative. And by the latter, the moral imperative, it is the modeling that occurs when networks see what others can and have accomplished that should become standard practice for themselves with the necessary modifications. The Ford Foundation representation by Hillary Pennington interested me because I was in Bangladesh in the 1960s working in family planning under a Ford Foundation program. And the watchword of the foundation at that time, and it was so for a lot of the foundations working in developing countries, was institution building. That was their end goal. Now, I went back 10 years after we had spent 2 years building an institution for family planning research and evaluation. And I couldn't find anybody that I had known there in that institution, and I despaired that we had failed at institution building. But when I inquired around, it turns out that all of those people we had trained were now working in strategic positions in government agencies. And so I think when we think about institution building and capacity building, we need to think about the building of individuals as well as the building of organizations. James Shelton, on the last panel, argued that the number one thing that will inhibit our progress is the failure to build capacity to carry out their own data development and evaluation. And I like the comment from the audience. I think it was James Glass from the UC system who said that they have concluded that one of the biggest obstacles to progress on this kind of learning among faculty is the ineptitude and perverse incentive system, some of my own words inserted there, for university professoriate to get out into the community and work with the community. So I think that gives you the flavor of how one member of the Friends of Evidence perceived the discussions today to be addressing the core of our offering as background for these discussions. So thank you all for that.
Thank you for that. That was really very helpful. I'm going to turn immediately to the audience. I have many questions and many other things I'd like to say, but I want to make sure that we have a chance to weigh in as a collective. So I'm going to turn to the audience now. If you raise a hand, here's a hand here, and then I'm going to come back to the panel so it can go both ways. There's a second hand. I don't know if it's just one mic or several.
Mark Friedman, Fiscal Policy Studies Institute in Santa Fe. Some of the most important change processes we've talked about today are ones where cause and effect relationships are not clear. When you're talking about community change processes, many, many players, many factors contribute to improving the percentage of children, for example, who are ready for school. And I think Sandra, in her presentation, exemplified the kind of changes that we anticipate and hope for in the Promised Neighborhood Initiative. But in all of those cases where we're successful, cause and effect relationships and therefore traditional evidence processes will not apply. In 2 or 3 years, Sandra and others are going to be seeking funding to continue their Promised Neighborhood work. How are we going to get the funders and the research and evaluation community to accept the kind of evidence she presented today about their collective work producing demonstrable, measurable change when it is not clear causality that can be proved in those cases?
Well, one thing we're hoping is that you're going to help. But Michael, that sounds like a question for you.
Sure. Well, one of the things, I agree with Jim around this notion of creating a market for results for this type of work. And so one of the things that the Casey Foundation helped us do in September was actually hold a funder briefing, where we brought together, it was about 20 plus funders to help them begin to understand what's happening in promised neighborhoods, to really understand the complexity. So as soon as they walked into the room actually looked different. They actually could see the sites there with their data, talking about where their baseline is set and how they're trying to progress. And so that whole purpose of that conversation was to begin to get funders to think about holding the complexity and not trying to reduce it back down to something that is easy to fund. The thing in that is that while you can't attribute causality, you can finance functional areas of expertise. And that is important. Sandra's playing a critical role as the backbone organization. But that's only one functional area. So what we're encouraging sites to do is the sooner that they can lay out what we would consider to be a supply chain, so that people understand it and understand all the various components of it, then people will know how to capitalize it. But that's the work that we have to do to help folks get that. And starting with having these kind of funder briefings where folks have a chance to unpack it, spend time with Sandra, spend time with families to really get this work is the initial start. The rest of the work happens outside of that. Getting our network to adopt a disciplined approach, results-based accountability, buying a national data system so that we're not making excuses for not having data, getting the Urban Institute to create a seminal document around data guidance for the field, all of that infrastructure building. Without that, we actually don't have anything to sell. So the first thing is to get the infrastructure built. Then the second is to take on the ownership of telling the story in a different way.
I don't know if you meant it this way when you said it, Larry, that the best evidence gets squeezed out of the pipeline. But it seems to me that this is connected, because I can't tell you how many times I have had to respond to the question when talking about the Harlem Children's Zone and how we were using the principles that created the Harlem Children's Zone to really inform Promised Neighborhoods. People can't wait till I stop talking to say, but if you can't replicate Jeff Canada, you can't do it anyplace else. I mean, let me finish, okay? And it seemed to me that that's squeezing the best evidence out of the pipeline, that if it takes leadership, and most things do, why don't we invest in building leadership rather than say when leadership is a key factor, let's discount that. But there was a question in the back.
I was so struck by what you just said, I forgot. Okay. Actually, I'd like to return to this issue of capacity. After 15 years at Robert Wood Johnson Foundation, I hope I've seen it all. I've seen shoestring operations that latched onto these quality improvement ideas and collaborative learning immediately. I've seen really highfalutin nonprofits that resisted like you wouldn't believe. I do agree that part of our challenge is with the academy. I wonder, Larry Green in particular, this reminded me of our work with Community Campus Partnerships for Health, trying to help these dedicated young scholars that wanted to do community-based participatory research to try and figure out how could they be cunning about, piggybacking things for research service, et cetera. Do you know anything about what happened subsequently there? Did they make headway? Is it like everything else, sort of imperfect and a normal distribution like Tony Brett showed us?
Well, yes, I do know a little of the history of that attempt and some of the outcomes. The fundamental problem is that the ones who really want to do participatory research are the assistant professors, the young scholars who come in, they're full of energy, and they're still imbued with a sense of community. And I myself am very reluctant to advise them to do that because it's academic suicide if you think about the labor intensity of having to do it. But what the Community Campus Partnerships for Health did to try to overcome that barrier was to collect dossiers or portfolios from associate professors who had succeeded in getting promotion on the strength of their community-based participatory research. And they set those up on a website and in packets that could be distributed to assistant professors who wanted to do that, were brave enough to do it. And that became a real resource for helping it to happen.
Yes. 2 questions on this side.
We had one in the queue.
Where? Just, oh,
That's right.
all right. It's that light.
Sorry, I'm under the light. Karen Pittman, Forum for Youth
Hi,
Investment.
Karen.
Hi, Angela. I want to go back to the word you started with, which was context, and take 1 minute to share a conversation I had a couple weeks ago with someone who was leading, I think what at least looks like a successful collective impact cradle to career initiative. I mean, I ask you all to, or whoever wants to comment on what I see as a dilemma in sort of the space between data and common sense. So this was a lunch in which I was asked to sort of review the plan, which has been sort of one year into the making of a community that went through the collective impact process, put together a set of work groups, has recommendations in each of the work groups, and has successfully implemented sort of the low-hanging fruit in each of those work groups, and was now saying, how do we reorganize ourselves to now do the hard work? So I dutifully read the plan and was ready to sit down and talk to them. We chatted about how to get folks organized for implementation rather than just organized for planning. But I asked them a question which really stopped them in their tracks and changed the conversation. The very last page of, I think, what was about a 40-page plan, it said, in the course of doing this plan, we decided that it was beyond our scope to look at these things: transportation, poverty, housing, and a couple more. And so I sort of said at the end of having a conversation about what they could do to get a little higher up on their recommendations list, I said, just ask you a question, no disrespect. If you could make a 50% change in those things on the last page, do you think you'd have more impact than if you did everything in the front 40 pages? And they just said, yes, but we don't do that stuff. And so the other thing I'll just throw into this is when we come into communities and we facilitate community conversations, and we basically take people through a process, community people of sort of thinking why here, to whatever the indicators are that have been put up on the board, 80% of the things that they put on their pieces of paper and stick up on the sticky wall are things about transportation and housing and healthcare and poverty, not teacher quality or the things that we want to work on. And so it seems to me that the question I have is, if we were really using big data, this would hit us in the face over and over again, that those really are the issues that we have to work at, but we're not. So we're allowed to look at evidence sort of selectively in the places where we want to look at the data that connects to what we want to work on. We're not listening to the participants who want to put those things up on the wall, and we're actually then not going to the partners who are in transportation, those folks who are running those departments, or even running those collective impact efforts in a different space, and asking them to come to the table. After about an hour of talking, they figured out how they could do this, but the thing that convinced them was me saying, if as you're doing your work, 50% of the people, the young people in your schools are not going to be able to use the things you put in place because of those issues, can you have the impact that you want? So how do we bring this into the conversation? How do we bring that kind of context in so we get those partners from those other agencies to the table earlier, and we hear the participant voice about the things that really stop them from using what we put in place?
Thank you. I'm going to turn to the panel, and then we'll take both of these questions over here at the same time. Anybody want to respond?
Well, I think what you've itemized as the things that were left out is exactly what I was alluding to that gets squeezed out of the NIH type of pipeline, the evidence pipeline, partly for reasons that they are difficult to study relative to the things they can get their data systems around, and partly because they haven't been encouraged to study them, but I think most of all because the journals aren't interested in publishing all of that stuff. They're focused on testing hypotheses about cause and effect. And so the cause-effect issue that was raised over there, I think, is really at the heart of our problem here. It is a notion, cause and effect is a notion from the physical sciences that simply doesn't apply so readily and comfortably to the social and behavioral changes that we're dealing with. And the social changes in particular are elusive.
Either of you, Shivan, Michael?
Karen, I think that is our challenge. The reality is in our sector, we hold many dominant logics that defy common sense. And because we're not bringing a disciplined approach to our work, we often miss it. And so for us, part of our challenge as leaders is to figure out how do we develop containers that will hold all of that energy that we know is going to get sidetracked to the easiest thing to do and avoid the complexity. So for us, what we use is the technique in results-based accountability that requires us to stop and ask, what's the story behind the indicator trending that way? And then what is the right mix of solutions? We had to get so basic as to just call them out. What's the right mix of families, programs, policies, and systems that will allow us to achieve results at scale? As leaders, when we bring people into these rooms and the container is not set to have that conversation, it really devolves into like a Saturday swap meet. Everybody's vying for their thing, void of context. And they're thinking about what the funder's going to want. And so for us, the challenge is for me as a leader, accountable for our own results, is to figure out how do I bring people into a space where they can do transformative work, where I have anticipated the complexity and the challenges of getting people to think about it, the dominant logics that they're going to hold that I'm going to judge as not having common sense, and not to fight against it, but actually to do something about it in terms of how I'm creating an environment to do some new work.
And I think that King County in Washington can teach us a lot about the question that you just asked. Because once they set the goal as achieving equity, they then backed into what does every department and every intervention that they have any control over in terms of their government resources contribute to that. So, and in order to answer that question, they talk to the people whose lives are going to be impacted. So when they ask about employment and getting the health services, transportation came up again and again. And so they then began to redo the routes and to make sure that the buses were running at the right time, and it's making a difference. But when you actually say, what is the goal we want to have? And then you back into all of the things that impact it, it begins to move us in a different direction. But let's take these two questions and get some response so we can get more engagement.
Thank you. Good afternoon, everyone. Mark Joseph. I'm a professor at Case Western Reserve University in Cleveland. I'm going to take us back to the question of the academy, but we've been talking about the academy and community-based research, I think an important question. I want to ask a question about the role of the academy and the evidence framework, and kind of the role of the kind of inside out of the academy building and promoting it. For me personally, this meeting has been absolutely exquisite timing. Along with colleagues, we've been beginning to conceptualize an intervention study. And sitting here, I realized that we were on the wrong path and we weren't taking a big enough risk. And my situation, the opportunity is, as a tenured professor now, I can take a more risky, ambitious inquiry. And having, for the last 10 years, been kind of mapping the landscape, some of you in the room know my work is on mixed income communities, mixed income development. So we've done a lot of descriptive work, what's going on, what's happening. There's also an opportunity now to shift to what are the interventions that might work, and how do we help test those out? I was headed down a more conventional path, though, and exactly the path that Tony laid out in his slide, right? What's the federal source? How do we, and I'd really committed to, well, this is going to be a multi-year process. It's going to be years, 4, 5, 6, longer, before we really have the evidence that we're starting out on a pathway to get. So I'm convinced now that an improvement research framework approach is the right one, but it leaves me with several questions, right? What's the funding path for that? How do I build credibility among my colleagues and at the university? Where are the peers who I can connect with who are also thinking about this? What are some of the partnerships that we need to build? There's no clear recipe, as there is for professors who want to do the NSF or NIH type path. What's the recipe? How do you put this together? So I think my question maybe is more for the friends of evidence, is what's the strategy for kind of taking this into the academy, looking strategically for settings within the academy where it might take root, so that that becomes a real partner in promoting the evidence framework.
You have the second question. There was another hand over here.
So this will definitely build on Mark's question. I'm sorry. I'm Bob Segi from the Center of Studies of Social Policy, and I'm a recent emigre from the academy. And it's, I think that Larry Green helped push me along that path that led to my emigration. But I just want you guys to comment. It's very related to what Mark said, and that is there was an earlier comment that when we do evaluations, they bring in the stakeholders, like what the state agencies are going to want to see to make some change. But if we think that we want to change what the evidence structure is that the federal government will accept for funding programs like maternal, infant, early childhood home visiting or NIH funding, what do we know about what they need to see this? Because I think that Angela says a very friendly audience here. And we all came because we are friends of a particular kind of evidence. And apparently we're foes of another kind of evidence. But in order to make change, we're going to have the major funders, and no offense to all the foundations here, but NIH has a little more money going on, and NSF and OMB. And what do we do from this perspective? What do they need, and what can we produce to change so that we'll go from being early adopters to being the majority?
Do those questions prompt answers?
Yeah.
Oh, we have a third? Sure. No, let's do it.
I've been trying for a while, and it fits right in with what they're saying. I'm Sue Popkin. I'm at the Urban Institute. I fled the academy more than 20 years ago very gladly. I do applied policy research with the kind of framework, informative evaluation that you are describing. I think there is a community out there. I'm certainly trying to build more of a community out there. I have an NIH community-based participatory research grant. We are happily doing the work here in DC. I know a lot of other people who are. I think you need, as the Friends, to broaden your perspective too, to take in beyond the tenure track folks. I think schools of social work clearly do this kind of work too. There is a whole world of researchers out there who are doing this kind of applied work, would like to do more of it. The more that you can help support us, the more we'll have, more evidence we'll have that this kind of research is important. And I just want to put a plug in for community-based research and data. My colleagues at the Urban Institute run the National Neighborhood Indicators Partnership that try to help communities do their own data collection. Been doing it for a long, long time. It's a great thing, and I hope there'll be more support for that too.
I'm sorry I didn't see your hand, but I'm so happy you stood up because you pointed out what I was going to point out in response to the question. I also want to refer anybody in the audience who's not familiar with the work of Meredith Minkler, the School of Public Health, UC Berkeley. I think she just retired. She has a body of work on community-based participatory research, which is absolutely extraordinary. But let me see if these last questions prompted any response.
I might just share one thing that Results for America did earlier this year. We found in our conversations with folks both on the Hill and inside agencies that they are very much in need of more information on effective evaluation strategies, when it makes sense, in what settings, and what to do with the information. No one in those roles outside of IES is an evaluator, and yet they're working in this context. I'm not an evaluator, I'm no longer in government, and yet the folks that were often making decisions really didn't feel they had a safe place to find the information they needed. And so we actually partnered with Michael Greenstone, I believe now at the University of Chicago, previously at Berkeley. And we hosted, in partnership with OMB, an executive education course, a half-day event. We had about 70 people, mid-level managers, so not the folks at Jim's level here who get to talk about these issues, but the folks actually running some of the programs across about a dozen agencies. And we basically had 2 or 3 academics explain the range of evaluation strategies and when they make sense. And just to even have this large group of folks walk away understanding what the different terms were was significant. And having folks understand that in RCT it does not make sense in many, 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 if not most settings. And just really having them think through what the terms were was significant. But the best thing was at the end, we had each of the agency teams, most of the agencies had about 3 to 5 people, basically think through a program that they're running that could benefit from some kind of an evaluation. And then we paired them with academic researchers who wanted to then help them develop a study. And what we found in this, we're hoping to do it again, but what we found was there is, like you said, a large group of academic evaluators who want to be doing work that's more relevant and with ready data sets. And of course, there were lots of people inside the government thirsty for that kind of partnership. So we haven't figured out exactly the right next step, but I will say our partners at OMB were very excited. The 70-some people who came felt like they learned something. And so it's a small step, but I think the main takeaway was there's a need for capacity building everywhere. and very much inside all levels of government. And in some of these instances, it's not at all obvious where they go for that kind of training and support.
Quickly, Larry, then I want to summarize because I think we're up. Yeah.
Quickly, the three questions. First from Mark. What strategy for funding vis-a-vis academic criteria for promotion and tenure? I think the only hope that in the short term can expect to change that is some work with the promotion and tenure committees of faculties in revising their criteria to make them more hospitable to this kind of research and to reward it rather than penalizing it. So that doesn't solve your problem in the short term, but it is a strategy that I think we ought to collectively pursue. On the second question, what to do with respect to the NIH funding priorities, as the third questioner pointed out, the NIH is funding some of this kind of research. It's spotty. It had a good run with the the National Institute for Environmental Health. Then there was a change in leadership there, and it sort of fell back and is scattered around the other institutes now. But we need to give it some prominence and recognition and hope that it'll be sustained. But NIH is one in a long series of funders who have done some funding in this area and then backed off for one reason or another, and I can't explain them all. Mary Minkler's work at Berkeley and the work at Michigan and Hopkins was all rewarded with the Kellogg Foundation funding community-based research scholars. The Robert Wood Johnson Foundation funded the clinical scholars to do this kind of research very specifically, but that program has ended. CDC funded CBPR through the Prevention Research Centers, but the new director at CDC is less interested in this line of research, and so it's not going forward. So peaks and valleys along the way. We've got to try to build on the peaks and sustain them and find ways to address the valleys.
And that just responds to one of the final questions I had, which I won't get to ask, and that is, what has to change at every level for us to be able to achieve the outcomes? And I just want to remind us of all the levels. We need to have evidence that honors the urgency that parents and children and communities bring to fix these problems. We need evidence that brings the confidence to invest on the part of government and others who have the resources to address these problems. That we need to have evidence that brings accountability into a system in which various people who work in and control that system bring varying levels of commitment to the change we want to see. We need to have evidence that enables those who are working on these issues on the ground with all the passion and commitment and access that you can possibly imagine, who need to know how to be able to do that work effectively. And we have to be able, as a society, to be involved in a societal conversation about what kind of nation do we want to be, and how do we know whether or not we're getting there. But thank you very much.
Thank you.